My client is an entrepreneur. He's on the news, so he's very well known. Didn't have any kind of experience like that, right? You come in and he could only lift it like not even like like a 30%. And with that experience, he brought me onto the news because he's like, I think everybody should know about this treatment and how much it could help, especially our elderly that are struggling with these kind of things.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Kat Sanchez, who started Elysian Contours and utilizes the Balancer Pro treatments to provide non-invasive, holistic healing to people in Hawaii. She is also a clinical massage therapist with a desire to deepen her understanding of the human body and treat each individual with a more informed and personalized approach. With her expertise, she supports each of her clients' recovery by assessing their anatomy, movement patterns, and individual needs to create the most effective, results-driven approach for them. So Kat, welcome and glad to have you here.
Hi, aloha.
So let's dive right into it, Kat. How did you first get interested in aesthetics?
In the beginning of, I want to say 2023, I was about 200 and maybe 65 pounds, and I am now like under 200 pounds, and I've realized that investing into your health, not just as on the outside but the inside, really is a great value to your overall, not just physical but mental health.
And you mentioned, in the introduction, you brought this Balancer Pro treatment. I think you were the first one to bring it to Hawaii, right?
That's correct.
Okay.
So I first did that treatment out in LA and in Beverly Hills.
Mhm.
I was looking for non-holistic treatments to help with my detoxification process. And in the process of doing my series of treatments, I not only started feeling better from the inside because it targets your lymphatic system, but it also gave me a nice body contouring. I suffer with lipedema, so that really did help with clearing out the skin and increasing your blood circulation. So I overall just not just felt better, but also looked better. So I figured, what a great opportunity to bring this to the people of Hawaii. If this had worked so well for me there, and we don't have treatments like this here, I figured what a great opportunity, right?
Mhm. Could you tell me a little bit more about what it is and what it does? Because I've heard a lot of different treatments, but I've never heard of this one before. So I'm actually really curious. Like, could you kind of break it down in its simplest terms? Like, what is it? What does it do?
Okay, so it pretty much focuses on your lymphatic system. So your lymphatic system is a system to detoxify your body, increase your circulation, move out toxins and waste, and we all understand how important that is. So if you clean out your body from the inside out, everything else starts to fall into place, right? So it is a compression therapy that helps to increase your circulation, move out toxins and waste, and pretty much helps target not just your swelling, inflammation, edema, but also in the aesthetic side where people are struggling to lose weight because their lymphatic system may be backed up or congested. So all of that plays into a big part.
Okay. And who would you say would be the best candidates for this type of treatment?
Pretty much everybody with a body.
Okay.
Yeah.
So what would you say it's and you kind of touched on this before, but I just want to dive a little bit deeper. Like, what is the conditions that people would have, or the issues maybe that they're facing where they would really benefit from this type of treatment?
Okay, so 90% of my clientele have some sort of pain, some kind of limited range of motion. They are in wheelchairs, they're elderly, people that suffer with sciatica, because sciatica most of the time is muscle tension that pinches up on your nerve, or it's inflammation, right? So you have a lot of inflammation, joint problems. So people that can't find that kick to want to get up and start exercising. So, and a lot of times it's the circulation. So we are pulling with stagnant blood in the bottom of our feet. So all of my clients that are on these treatments need increased blood circulation to bring back new oxygen blood back into their muscles and tissues, flush out all that inflammation and swelling, edema out of their body, so that they can start to heal a lot quicker than what our bodies can normally do.
Okay, got it. And Would you mind sharing a little bit more about your story? You kind of touched on it in the very beginning, but I really want to dive deeper because you sent me over in your bio like this amazing story of kind of what your journey was, how you found this, and kind of what it did for you. So would you mind just elaborating a little bit more on kind of your story from before and kind of how you got to where you are now with it?
Yeah. So, in short, I was overweight. I had 3 children. It was COVID. I didn't have any motivation to, exercise or do well. I was working. I'm originally a hairdresser that works on film, so big production movies,
Mm-hmm.
TV shows, and on one of my filming shoots, I fell and I landed on my back. And I already suffered with sciatica, but this time, this fall, I landed like completely just smack on my back. And I was okay. 2 weeks later, that's when everything started going downhill. I couldn't walk for a whole year. I struggled. I would be on those little scooters because sitting, standing, I was just in constant pain. I'll be in the ER almost at least once every 3 weeks to get shots. I did acupuncture, chiropractor, massage there. I spent thousands of dollars trying to figure out how can I get this pain, manageable, because now I'm climbing in weight because I can't move. I would always work towards exercising so I could bring my weight down, and that didn't help. Then I started eating healthier because I couldn't exercise, so that helped me drop most of my weight. I went to LA and I was there for a training seminar for hair, and I saw this wellness center that was offering that service, and I said, oh, that looks kind of relaxing and cool, let me try it out. I did a 12 series flush out, and it was in 2 weeks. I did all of them back to back to back, and I noticed that I was flushing out inflammation. So you would be just detoxing everything out of your body that your body is holding on to. I noticed that there was an improvement in my legs for my lipedema. My abdomen, the volume of bloating started to go down. My energy started going up because now all the old blood are getting recycled into my lungs and tissue, my lungs and heart, and we're bringing back in new oxygen-rich blood into my muscles and tissues, and it was really giving me more of energy to start exercising more. And then I came home after my trip, and I noticed, wait a minute, I don't have any sciatica anymore. Like, no pain, zero pain, which is crazy because it's normally a 7 to 8 pain level for the past year. And when I realized when I got home it was zero, I told myself, could it be this Balancer Pro? It never was designed for sciatica. But the science behind it is when you're flushing out inflammation, swelling your toxins out of your body, you're now healing yourself from the inside out. And a month goes by, 2 months go by, and I'm like, I still don't have my sciatic pain. I said, okay, I want to continue this service. And I look up where's the nearest location that I can do this service, and it said no, none. Nobody in Hawaii is offering this service. So took a leap of faith and invested into this machine. Brought the first one in November of 2024. Opened up the business in 2023 of November. I brought it into Hawaii. 2024, January 2024, I opened up the business, and from there it's been doing really well because it's just helping these individuals that are looking for a holistic, non-invasive way to get healthier from the inside out, and really just finding some peace of mind that they can start getting back to the things that they love doing, whether it be going back to work, playing with their children, their grandchildren,
Yeah, and that's an incredible story. I mean, just from that pain, like the constant pain, like what's the solution? Maybe you were thinking during that time, maybe there is no solution. Maybe you just have to live with this for the rest of your life.
Yeah.
I know a lot of people that have had that chronic pain, and it's like they've tried everything. It's like, is this how I have to live the rest of my life? And then you're able to find this, and then you're able to find that solution for you. Now, that's incredible. Now, I know that you also brought in Emsculpt, and now you're combining Emsculpt with this. So can you talk a little bit more about, I guess for people who don't know, what Emsculpt is, and then more particularly how this is complementing the Balancer Pro treatment?
Yeah, so I recently decided I wanted to bring in the Emsculpt because the Balancer Pro, it focuses on your circulation. So moving out toxins, waste, it helps to, bring back oxygen rich blood back into your muscles and tissues, but it doesn't address muscle atrophy. It doesn't address fat loss. For my clients that were using it for their body contouring journeys, it helped them to lose the volume. It helped them to really clean out their digestive system with the Balancer Pro. So now adding the Emsculpt to enhance their results, it's a game changer. So the Emsculpt, what it does, right, is it helps. They have two technologies, which is the radio frequency, which helps to warm up the muscles and also burn fat. So it actually is targeting the fat cells, burning and damaging them. And then the high FEM, which stands for high intense focused electromagnetic, what it does is it contracts 100% of your muscle fibers. And when that happens, when it contracts at 20,000, when it does the 20,000 contractions. So say, for example, if you are somebody that is struggling with a low range of motion in your shoulder, you normally have like PT do the work, but it takes so much of our other muscles to have to move that one muscle to get that range of motion back, versus if you were to just relax and let technology take over and it will just contract those muscles at 100%, you will feel a lot better in a 30-minute session than you will maybe 10 sessions of PT. So it really is like it's kind of comparable to 40 massage therapists working on that one area and contracting it at a 20,000 muscle stimulation contractions, right? So with the radio frequency to warm up the muscle, high FEM to contract it, it is a powerful tool. And then you hop into the Balancer Pro to flush out any lactic acid buildup, to increase your circulation. Now you're bringing back, after contracting the muscles, you're now bringing oxygen-rich blood back into the muscles and tissues, so that the repairing process is pretty much being accelerated and amplified.
Got it. So they're both accelerating each other's process.
Oh, 100%. Yeah.
Okay, got it. Now, I want to talk about your practice and really kind of what differentiates you from others in the industry. And I know that you being the first one to bring it to Hawaii probably set you apart from many other people. But what are some other things that you find that you feel like really set you apart from other practices?
I think because I have lived it, I can be more empathetic towards the clients, and really understanding their situation and how we can work together towards their healing journey. Because I don't just work by myself. So for my clients that are in the weight loss journey, I work with other doctors and people like Joey as a nurse practitioner to help me and guide my clients into the right direction for their success. So I don't just have them come to me and this is all I do, which most practices are like, oh, sorry, I don't do that. And they won't make the recommendations, versus when they come in for consultation, I really take the time to sit down and understand their situation, what their current situation is and what their long-term goals are. And from there, I make my recommendations to say if this would be a good fit. If it is, great, we can start. But I also would like for you to see this doctor, to see this nurse practitioner, so that we can make your whole journey a successful one.
Okay. And I want to dive a little bit deeper into the educational part. Like, how do you educate your clients about what you offer? Because I'm sure for a lot of them, they've never heard of the Balancer Pro before. So how do you approach that educational part of it when they have no idea what this thing does?
So most of the time, I post a lot of educational videos on my social media. So that way they have a visual. And by the time they come in, they've already had all the bits and pieces of what the Balancer Pro is, why is it important, what is your lymphatic system, what is the Emsculpt, and understanding why these two together work great and why they work great alone, and then when they come in, I still do pretty much the whole consultation, and I have visuals and I have like little pictures because sometimes each individual learn differently. And so I make sure that I give them the information that is best for them to understand, because there's so much information on your lymphatic system and your muscles and all that I need to just break it down, sometimes in pictures and in layman's terms.
Okay. Now, I'm sure that you get a lot of misconceptions about what you do. So would you mind sharing just some of the most common misconceptions you hear from your clients or anybody else about this specific treatment?
I think the biggest misconception is that they can do this once and that they're gonna feel an automatic change. So a lot of times I tell them, if you do anything once that's positive, you're gonna get that in return, right? So if you eat one salad, of course you're gonna get all the nutrition from it, but is it gonna get you to your goals of weight loss? Probably not from that one, So a lot of times they think that, oh, I'm gonna lose weight from this. It's really all the efforts that you put into your weight loss journey. I'm just one part of it, and what you do on your own time, the 23 hours, because you're only with me for an hour, really will determine how your journey is gonna go.
Okay, got it. So it's not a silver bullet by any means, but it's just like anything else health-wise. You got to keep doing it. You have to stick with it, and you have to follow the protocol, right? So when it comes to, and I want to dive a little bit more, because this is both the Balancer Pro and the Emsculpt you mentioned is non-invasive. So I think most people kind of understand that part of it, but when it comes to making sure that people are safe during the treatment, and even for people who don't understand really what non-invasive means, would you mind just explaining a little bit more of like what is involved in this? Like, do they need to go under anesthesia? Like, do they need to be put to sleep? Like, I think for just like, could you explain that a little bit more for people who don't understand that process?
Sure. So when we say, non-invasive, it pretty much is like there's no needles, there's nothing like penetrating into it. It's very comfortable. It's not like when you go into, let's say, a therapeutic massage where you need to take off all your clothes. The only part maybe you would take off your clothes or keep the area clear is when we're doing the Emsculpt. So if we're going to be treating your glutes, of course we need to get as close to your skin as possible so that you don't get burned from the radio frequency. But other than that, the Balancer Pro, you can go into your regular clothes. You just lay into this pantsuit. It's really relaxing. And a lot of times when people come in for one thing and they do the series, they realize so many other things started to follow. So for example, people that came in with high blood pressure, they're like, I have sciatica. All of their numbers started to, get a lot better because now they're triggering their parasympathetic nervous system. So they're relaxing more. Their high blood pressure starts to come down. Their cholesterol goes down. They start making better choices. And it's all because of non-invasive treatments having to feel like a lot of times they're nervous about, getting poked or getting under for these treatments, or other painful treatments that they have to actually do the work. Whereas when they're coming to my practice and they're doing this treatment, technology is doing all the work for them, and all they're doing is just watching TV, relaxing.
Okay, that sounds like the perfect treatment. You can watch TV while you get it. And is there any pain with it?
The only pain that they will feel is when they first come in. And then once they leave, they will feel a lot lighter in their legs. They'll so for example, one of my clients yesterday, she has pain in her neck, a limited range of motion in her neck, and she's had it for like years because she's a hairdresser. So a lot of times she's looking down. So when she came in, she couldn't move her neck. So we did the Emsculpt to address her muscles in her neck and shoulder area. And what that did was it provided the radio frequency to warm up the muscles and contract those muscles to really break up those muscle fibers and release them. By the time she left, she was able to move her neck. And that's the most painful part you'll ever feel, is when you first come in. And by the time you leave, everyone's usually very happy, and that's when all the blood pressure starts to go down, right? Because now they're feeling a lot better than when they came in. That's the only time they ever feel pain, is right when they come in through the door, and then when they walk out, they're just a lot better.
Yeah. Now, you mentioned that person who came in with the limited range of motion. She left pretty much immediately after and now had a much wider range of motion. Your story was incredible. Just the constant pain, the chronic pain, you got that solved. Do you have maybe another story that you can share, maybe one of your clients, of when they came in, they had kind of this really challenging case or really big issue, and how you were able to get them a great result out of it.
Yeah. So one of my clients is an entrepreneur. He's on the news, so he's very well known, very busy guy. When he first came in, he had a limited range of motion. So every day that we do things, right, we're always like just dealing with the pain. It just gets worse. And he couldn't lift up his right leg. His hip flexors were really tight, and he really wasn't expecting anything because he's a guy that goes and gets all these expensive treatments. And when he came, because he heard from a friend, hey, you should try this out. If you're actually, he came in because he said his back hurt. He had sciatica. And when I asked him, are there any other issues that you're dealing with? Yeah, I can't lift up my leg. He could only lift it up maybe 30%. We took a video of it. We took a video of him lifting up his leg, and you could see in his face just he's annoyed because I'm making him go through these exercises to show his range of motion before, because I knew the moment he comes out that he would have a full range of motion. So we get him into the pants portion for 40 minutes. Actually, we did 45 minutes this time because I felt like he needed more time. Then we did a 30-minute session for the jacket. When he came out, I said, okay, how are you feeling? He goes, oh, my legs feel really light. Yeah, my back feels great. And I said, okay, go ahead. And I'm recording him. I said, okay, go ahead and lift your leg. And he lifted his leg. His knee was touching his chest.
Oh, wow.
In one session. And so he was just sold. He was so happy. And he was just didn't have any kind of experience like that, right? You come in and he could only lift it like not even like a 30%. And with that experience, he brought me onto the news because he's like, I think everybody should know about this treatment and how much it could help, especially our elderly that are struggling with these kind of things.
That's amazing. Incredible stories you have for this thing. It's incredible. And when it comes to this, I mean, what part do you believe that, or how much is science as far as like you have to follow a protocol, you have to follow a system, and how much is art, where it's like you kind of have to take a look and see, okay, for you individually, I need to do something a little bit different. You kind of mentioned that with this guy, you had to give him a little bit longer because you felt he needed it. So how much would you say that this is going to be art versus science?
So it's 100% customizable to each and every person. So during our consultations, I gather everything from them. And when I say everything, it's what does your day look like? How does your sleep look like? How do you sleep? What do you eat? And what are your activities? Because from there, I go ahead and put everything in. What kind of medications are you on? You know, do you exercise? Do you sit around? All these things play into part because it tells a story of what your body goes through. And from there, we have preset settings on the Balancer Pro machine. It was never designed for sciatica, but because I used it for myself and I, played around with all the settings, I actually was able to set up my own preset setting for sciatica. And with that, I understood the science of where your lymph nodes are, where your pain is coming from, where are you congested, where do we need to decongest, where do you need the most inflammation flush out. And from there, I can pretty much help each individual per time they come in. Of course, everyone is not gonna have that great first experience all the time, right? Sometimes you're gonna your first session will be a decongesting, then the second one you're gonna start moving fluid more and more. So depending on their availability and how I can pretty much customize their plan, and if they can commit to that plan, then they're definitely gonna have a quicker recovery. So there is, I would say, 50% science, because you have to know, right, like which areas you need to decongest, and then the other 50% is all customizable due to their lifestyle and their health choices.
Got it. And where do you think the future is, or the future is for these type of holistic treatments, non-invasive treatments, more natural treatments? Like, what do you think the future is for these types of things?
Oh, I think it's heading there. A lot of people are getting more sick with just taking pain medications, and it's really just a band-aid. Like I said, in my experience, right, like I would feel great after I got one of those shots at the ER because my pain, I couldn't get off a toilet. and I would be crying, and for someone to take me to the ER because it was just that much pain. It would be burning all the way to my toes, and as soon as I would get that medication, I would feel great. I would come back home and I'm like, yeah, what can we do, right? The next day I would come right back. And you can't rely on that medication all the time. It's just not healthy for us, right?
No.
So I think that when people start realizing that certain medication, taking it too much, like I have clients that take Motrin every day or pain medication to mask the pain just so they can get to work, so that they can pay their bills. Once they have started this kind of treatment, and so this treatment that I do, right, the Balancer Pro and the Emsculpt, I tell them this is a jump start for you to get to a healthier place in your life. Then you do maintenance. So I get them to do like 3 times a week, 2 times a week, once a week, every other week to once a month. And what they notice is when they do the once a month, they want to come back once a week because they feel the automatic difference in their energy, in the way that they move, how light their legs are. So once people start to get that feeling of healthy, healthy legs, healthy on the inside, it's gonna take over. They're gonna be like, well, I don't need to take Tylenol or Motrin or ibuprofen every day. They're popping it in like candy because it's so painful.
Yeah.
That once everybody gets on this investing into your health instead of medication, it's gonna take off.
Incredible. So, Kat, I have one last question for you.
Sure.
Before I ask it, I want to point people to your website at elysiancontours.square.site. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting a treatment like this done, but isn't sure which provider to choose?
I would say just pick a provider that's closest to you, because you're not really seeing the actual provider. You're getting the treatment from this device. So you can't really go wrong. Each setting is going to give you the best results. And communicating with your provider about what your goals and your intentions are will definitely give them a better understanding, as well as to how they should set your settings so that you can get to your goals quicker.
Okay. Well, there you have it. Kat sharing her expertise. So, Kat, where can people contact you and your practice?
You can call me or text me. My number is 808-726-6974, or I have an Instagram and it's called Elysian Contours, and my website is elysiancontours.square.site.
Okay, awesome. Well, thank you for being on the show and sharing your message.
Thanks for having me.
Okay.
Aloha.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.